Hey guys, Happy New Year! I'll be sharing how my anesthetic nurse interview went. So this all happened last month. So I have been working in recovery as a registered nurse, and during my appraisal I've shared with my band 6 on my appraiser that I wanted to move up and improve on my skills, gain more skills, and because there are not a lot of advancements in recovery, I decided to express interest with the anesthetic course. So let's start first with what is the anesthetic nurse role. This is not the same with the nurse anesthetist in the US or nurse anesthesiologist. I forgot what the proper term is. It's not a nurse practitioner role compared to the US. So anesthetic nursing in the UK is a collaborative role working alongside with the anesthetist or a medical doctor who performs and administers the anesthetics, and primarily concerned with ensuring the safety of the patient all throughout the surgical procedure. This is also not the same with the anesthetic associate role, which is the only non-medical role in the UK who is allowed to administer anesthetics under the supervision of a consultant anesthetist. So the duties and the responsibilities of the anesthetic nurse includes the following: ensuring the environment or the equipment is safe, checking the equipment is in place and ensuring it is working, preparing drugs to make available for the anesthetist, assisting the anesthetist with intubation, cannulation, and line insertion, assembling and making ready equipment for IVs, monitoring, catheterization, and warming, caring for patient from check into the theater until the admission to the PACU, and monitoring local anesthetic cases. So obviously the anesthetic nurse works mainly in the operating theater, but we can also find anesthetic nurses or anesthetic ODPs working in recovery units and specialized units such as labor and delivery suites, day surgeries, endoscopy units, and other areas. In my trust, the anesthetic nurse works mainly in both main theater and day theater, but we're also called upon when there's an emergency case in maternity theater, which is almost always an instrumental delivery, forceps delivery, or an emergency C-section. Although anesthetic nurses can also be counted upon in the delivery of painkillers or during pain management, in my trust we have a separate pain team who deals with those kinds of concerns, although anesthetic nurses are expected to know these as well. So why did I choose to further my training in anesthetics? The reason why is because I want in the future to become more autonomous, or to have a more autonomous role. Although the recovery role is already an autonomous role, collaborating with the anesthetist. But I just realized that the more skills that I have and the more things that I can do, the more employable I am. And of course, the more skills that you have, the more profitable you are. At the end of the day, that's our goal, to earn more money, to bring back more food to the table. Am I making sense? Especially in this economy, there are slight disadvantages in work and recovery, at least in my trust. Like for example, we don't have a regular night shift. From there, I am losing enhancements. We're only working on calls, and on-call shifts are not really assurance that you will learn more. We do earn something extra, but it's not the same as, having a regular night shift. And also, if I work in anesthetics, I have the chance to work longer hours for lesser amount of days. Typically in recovery, I can't do 12-hour shifts that often because they only allow one person to do a long day, and the rest will be working shorter shifts, such as 9-hour shifts or 8-hour shifts. But with the anesthetics, especially with the state that we are in, where we're really short-staffed, and that means I could expect longer shifts but fewer days, which is really advantageous in our current situation. Another difference, by the way, between the anesthetic associate and the anesthetic nurse. For the anesthetic associate, one of the requirements is you have to be obviously a registered nurse or an ODP, an operating department practitioner, and the other requirement must be you have at least 3 years of relevant experience in that field. So by starting my journey as an anesthetic nurse, probably in the future I could end up as an anesthetic associate, probably. So what were the requirements for the anesthetic nurse role in my trust? So the most important is you have to have a PIN, which is the equivalent of a nursing license in the UK. Second is they generally prefer someone who has a theater background. So working in recovery is a huge advantage if you want to specialize in anesthetics. Although if you're working in scrubs, you can also try, although you may have a bit of a disadvantage because obviously the scrub role doesn't really work with a lot of medications, only with local anesthetics. So it differs from every trust. In my trust, the plan is to send 2 people, which is 2 employees, to study for the course, which will take around 6 months to complete. But we will be like working students. So we're not technically students, but we're still employees who are just studying a certain course, if that makes sense. And then we go down to the interview. It wasn't really a formal interview. It wasn't a panel interview like the ICU interview that I went to a couple of months ago. It was more like a presentation. So they asked us to prepare a 20-minute presentation which answers the following questions. The first question is, what is my understanding of this role? So I'm gonna share my PowerPoint presentation in this video. So this is how my slides look like. So for my first slide, what is my understanding of the role? I highlighted the fact that this is a collaborative role, not an autonomous one, because, well, technically that is the definition of an anesthetic nurse, according to the BARNA, which is the British Association for All Anaesthetic and Recovery Nurses. I've also added keywords such as a patient advocate, which is my short way of saying that I am responsible for speaking up for my patient who will be anesthetized and therefore who will be unable to speak and who will be unable to express their needs or concerns during the surgery. I've also added the keyword peri-anesthesia because I'm expecting that anesthetic nurses should work within the entire anesthetic journey. So from check-in, induction, maintenance, reversal, and after the surgery finishes, or when the patient is in PACU. I've also included another keyword, which is crash cases, which I meant to be the working environment that I am seeing as an anesthetic nurse. So I wanted to tell my panel or interviewers what I understand from the role is that you're not only working in anesthetics per se, but you are also expected to help with resuscitation cases, which I'm very much familiar with my respiratory therapy background. Actually, I kind of miss going to Code Blues. So having been stuck in theater for the past 4 years, I kind of miss joining the Code Blue team or even the rapid response team. So the second question is, what are my expectations of the course, the anesthetic course? And in my slide, I've included these 3 keywords, and I should have rearranged it better, but I would have started with theory plus practice because I'm expecting that this will be a blend of theory and apprenticeship. Like, I'm expecting that there will be maybe literature that I have to go over, exams, essays that I will have to pass. At the same time, I will have to observe and demonstrate in the clinical area. So it differs from university to university. Some universities will require you 1 school day or 1 university day for every month. Others will require every week. So it totally depends. So during that time that I have the presentation, I wasn't aware yet of which university they are sending us to, but then of course, when I got the acceptance letter, I knew that it will be Bournemouth University in Dorset. I've also included that I will gain more confidence and skills by doing this course, because right now, as a recovery nurse, sometimes I give anesthetic breaks to the anesthetic ODPs, and most of the time I find myself confused or I find myself clueless on what is going on. Generally, we don't set it up, we don't prepare it. I don't know where things are. So by fully doing the course, I would have an official understanding of what is going on, and that will hopefully make me less anxious whenever I am inside. Because as much as I wanted to help, the thing is, in the Philippines, this role is done by the circulating nurse. Although as a circulating nurse, you don't really have that much of understanding of the anesthetics. Like, for example, I never calibrated an anesthetic machine back in the Philippines. I think it's always the anesthetist who comes in and checks the machine for himself. So no, we top up the inhalation gases, but that is as much as we do with the anesthetic machine, because we don't know how to run it, we don't know how to do it. With my respiratory background, I can manipulate the ventilator part of the anesthetic machine. I know how to use the ventilator aspect of the anesthetic machine, and I have a good idea on calibration, because it's almost the same as calibrating a ventilator. But at the end of the day, I just want to be officially trained, like, certified to do these things, just to lessen my anxiety. So now the third question on the presentation that I had to answer was, what kind of support am I expecting for the role? 3 things again. First is time, because I am anticipating that my biggest challenge right now will be time. So our current family condition makes it really challenging to commit into something long at the moment, but at the same time, I thought this is an opportunity that is hard to miss, because I tried to apply for the anesthetic course last 2021 when I was just a supernumerary, and of course I didn't pass. So basically, I don't want to lose this opportunity again, because it may not come back for me. I am hoping that my managers would give me plenty of time to finish it, not to be pressured to finish it. I should have worded it better. But basically, that's the idea that I explained it to them. And they did promise me that I am still an employee. I'm not really a full-time student doing the course. So naturally, I can enjoy my employee benefits. My concern was that before this came along, I've already applied for annual leave on March and April. And the anesthetic course starts on March and April. My managers did assure me that I will be enjoying my annual leave, because that is my right as an employee. And that fixes my first concern. The second support that I would be needing will be resources. So it's not just links to journals, books, or websites that I need, but actually a real life person who will be willing to mentor me and teach me during the course. So I want to say I have befriended the anesthetic nurses and some of the ODPs. They were really happy on the news and me getting in the program, and they did promise me that they will help me with the things that I will need. Basically, they will answer my questions and they will mentor me when I start the course, which is really great because I'll be needing a lot of support. And the third is escalation. So right now as a recovery nurse, it's easy to ask help because in the recovery area, I will have at least 3 other persons to get help from if I'm in trouble or if I need something for my patient. Now, inside the anesthetic room, it will be different because it will just be me and the anesthetist or another anesthetist. I don't know if I'm overthinking this, but I'm just thinking, what if my concern is with the anesthetist? So it would be difficult to, get help because it's just you. So I can't just leave, abandon my patient and then rush, go talk to my manager like that. So it's not that simple. As a response, what I got was, actually I have improved with the way I escalate things. I got more comfortable, which honestly, I think I did, yeah. Because in the beginning, I was really hesitant to escalate things because I feel like, because back in the Philippines, if you escalate, you sound like a jerk. People will just ignore you and you just have to deal with the problems on your own. That's what it was. I've realized that it's not the same in this country, and I've become more and more comfortable escalating things and speaking to people. So the last question was, how would you be benefited from the course? So the biggest word that I put in my presentation is growth, because that's what it is. That's what I feel is the biggest benefit to me. Growth in terms of personal and professional growth. By joining the anesthetics, I will gain more skills, and that makes me more, bankable. The more skills that you have, the more things that you can do, the more bankable you are. My second circle that I put in is retention of skills. So I have RT skills, respiratory skills that I can't use in recovery. I'm just concerned that if I'm not doing them often, I might lose them or I might get outdated in them. So I'm hoping that by being in anesthetics, like an action-packed role than recovery, then I could retain those skills. And third, it would be really helpful for my long-term goal, which is to be in a more autonomous role. So I'm not really eyeing a leadership role or a managerial role in the future, because I don't see myself as a manager. I really want to be in a role that is highly specialized, or a practice educator, any of those two. And anesthetic course is just one of the many things that I can be in to grow closer to this goal. Right at the moment, the anesthetic course is the most practical, hopefully the quickest, because I'm already in theater. I have a theater background. Anesthetics is in theater, so it all plays out. So the interview or the presentation was only 20 minutes long, but then there was a question and answer after that. Not many questions. It was more me asking the questions than them, and that was roughly about 10 minutes maybe. And I had 3 questions. My first one was, how will be my schedule? And they said it will be an alternating anesthetic and recovery duty after I pass the course. The second question I asked was, who are going to be mentors? Because right now I myself is a mentor in recovery, and the student who was assigned to us for our placement, she's kind of following my schedule as her mentor. And I asked them if I'm going to do the same, am I going to follow someone else's schedule? And they haven't given me a clear-cut answer to that, but I guess we'll find out. My third question was, will I get a certificate for the course? And they said yes. It's a 20 credit module, which is a Principles of Anesthetic course. It varies from university to universities. Some offer a 60 unit course, which runs for 6 months. But I was told that in Bournemouth, they offer the 20 credit module. So I'll see what it turns out. As long as I'll be legally allowed to work in anesthetics, and I'm fine. So that's how my anesthetic nurse interview / presentation went. Do you think I made the right choice joining anesthetics? Thank you for watching. If you like this video, please click like and subscribe, and go visit my channel and find if you like my other videos. Thank you for making it at this very end. Hope to see you soon. I hope to see you on my next video and on my next post. And Happy New Year! By the way, Happy New Year! All blessings to your family. Bye bye.